Yeah, guys, just coming into prevention in the NHS for today. So, again, important part of our modern period. Okay, what's really having an impact here? Well, I've kind of already mentioned it in previous videos, but different approaches are being practiced, and the public have a changing attitude. They're aware of the new theories, they want to get more involved in public health, and the change in politics. The government has really a reason to get involved. So what do? Well, the government it does take a step in terms of dealing with problems in society to link to public health. So this movement away from laissez-faire attitude to now taking action, and partly this is because their increased understanding of what caused it, um, things like germ theory, etc., and methods of prevention. So compulsory vaccination is so important. I'm going to talk you through a few examples in the next slide, but they passed laws for the healthy environment, again the Clean Airs Act, communicating the health risks, promoting the healthy lifestyle campaigns. These have such a big impact in increasing the life expectancy in the country. So really important in terms of how the government steps in. And remember, if you've got a question on this, you need to bring in some of these examples to back up the point. And then at the end of this video, you'll hear me talk about the impact of the NHS. Look at some of those numbers in terms of life expectancy. That's really where you can explain why that is so important and why that has a big impact. Right, just a quick run through some of the things that occur during this. So in 42, you have the campaign for diphtheria as a national campaign, first of its kind. Basically, before this, local governments were responsible for it, but they were not funded by central government, which meant they were not widespread, and around 3,000 children died each year from diphtheria. So this was so important in 1942 that the national vaccination campaign is coming out and pushing for this. Right, 56, this is linked to polio. So there's polio, contagious disease, causes paralysis. About 8,000 cases a year in the 50s. So, the vaccination is actually developed by an American, Jonas Salk, who introduced it to the UK in 56, followed by a more effective one in 62. The impact, well, basically infections dropped rapidly. The last case of a person getting polio in the UK was in 1984. So a really important one to note down. Other vaccines were targeted diseases. So the HPV vaccine would protect women from infection and from an STD. Again, the government, it's just examples of the government really getting involved. We also get in 56 the first of the Clean Airs Act. So this was the government getting involved in responding to the smog in London in 1952 and trying to clean the air. Again, another one was brought out in 68. Smog, really just heavy fog caused by air pollution, like the burning of coal, particularly in London where there's a lot of people there. The smog could block the sun, for example. It's no longer a problem in the UK, primarily because of things like this, and we're still pushing for laws against things like car emissions, etc. Last one really was the smoking ban. So this was 1st July 2007, as part of the 2006 Health Act. Again, as I said previously, the campaigns to eradicate, well, not eradicate, but prevent as much as they can things like the links between smoking and lung cancer. There was always also, guys, new campaigns for prevention. Things like, again, as I've said before, campaigns against binge drinking, recreational drug use, unprotected sex. You've got events like Stoptober, which encourage people to stop smoking for a month. There are initiatives encouraging people to eat more healthily and get more exercise, Change for Life campaign, things like that. Okay, These next few slides are just examples of, again, new technology involved. So blood transfusions are far more have far more of an impact. Remember, we do study this a lot in the Western Front. However, at this point, they're far more aware of the different types of bloods you can use in terms of how we can store it as well. So do take a note of that. X-rays, again, which we study in the Western Front, it's really important for moving away from invasive surgery, and allows a more precise incision, especially in World War One, where you're trying to dig out shrapnel or bullets, and you don't want a doctor kind of having a guesswork. If you can directly see where the bullet is or piece of shrapnel, you just go in, take it out. Again, really important for monitoring the development of babies in the wound as well. Radiotherapy, chemotherapy, I'll talk about this a little bit more when we get to the lung cancer area, but again, it's just ways technology's been advanced to treat certain cancers. Transplant surgery, again, I will talk about this in later on, but again, these are massively advancing, where you can, if you get one failing organ, there is options to replace it and keep the body healthy. Customized drugs, again, one thing I will note on drugs as well, mass production of drugs is so important for accessibility, okay? So don't overlook that fact. If you ever get a question on, accessibility, mass production of drugs is so important. But customized drugs targeting specific health problems, very important. Keyhole or microsurgery, very tiny incision, allows things like endoscopes in. Dialysis machines, again, for kidney problems. Plastic surgery, we know from Harold Gillies in World War One, developing this to repair facial injuries. Improved anesthetics. So, we talked about under James Simpson the problems of the initial chloroform and use of anesthetics. Now it is becoming far more effective in operations, far less dangerous. Heart pacemakers, again, the advanced technology. Keep the heart. Right, just a bit on the NHS, guys. So I'm going to talk a little bit about how this improved access to care. It's launched in 48, so the government launches this basically to provide medical care for the entire population. It's paid for by national insurance contributions, so make a note of that, and it's taken from wages in the kind of same way that tax is. This is so significant because it's the largest government intervention into medical care. The new NHS basically took over existing hospitals, existing medical service, and there are three parts to it. In 48, you've got the hospitals managed by regional hospital boards, you've got the GPs, who are the general practitioners, and dentists, primary care, additional services, things like ambulance services, health visitors. The government basically wanted everybody to have the same kind of healthcare available, regardless of how rich or poor you were. Workers who earned under a certain amount had already been kind of entitled to this medical care through the 1911 National Insurance Act, but it didn't extend to kind of women who were at home, kind of raising a family. So after 48, women were able to get treatment for these painful conditions that you get. So it's really important. Hospitals, they weren't changed massively by the launch of the NHS. Post-war Britain, they didn't have much money to spend, but the government was responsible for over 1,000 voluntary hospitals and 1,500 city hospitals. So it was a huge undertaking. Many were built, but again, it was just a slow process. Again, think about accessibility in this point, how important the NHS was to get access. But a lot of hospitals needed that modernisation. So did GP surgeries. By the 50s, it was seen that GP surgeries were not entirely satisfactory. So there was a push to improve them. Access again is the most important thing by far in terms of what the NHS offers, because it's available to all. So provision initially didn't improve, but it's generally how it reaches many different people. By the end of the 40s, the UK has a lot of money coming in from the US to rebuild, and they're able to put things into practice. Now I'm going to show you in the next slide what impact the NHS has. So remember, the impact is key to how we can answer these top level questions. Right, so the impact of the NHS. So please make a note of these as we go. So medical care and treatment, regardless of background. Again, accessibility, poorest have access. People are living longer because of the NHS. It means, it's a negative impact, I guess, in that it's becoming more expensive. Prevention, the NHS encourages these healthy living ideas, use of modern technology. However, waiting times, delays are still common. High-tech medical treatment, so specialist treatment as well. That's a good one to use, the specialist treatment. So being government funded, the NHS can't really pay the same kind of high salaries that private care can. That's why there's a little bit of an issue with doctors maybe going elsewhere, top quality doctors going elsewhere for the money. Life expectancy, again, as I said before, it really helps increase life expectancy. So 83 in 2015. Again, this has other issues in terms of the strain on the NHS. Training nurses, get specialist training and skills. So aging, again, growing population. There's an increase in lifestyle problems, so which is putting a strain on the NHS. Things like drinking, smoking, drugs. They were imperative in terms of dealing with the coronavirus, and again the rising costs. So just keep an eye of those impacts. Right, I'll leave it there for prevention and care. Again, I'll be back with penicillin.